Hello, I'm Dr. Schultz, and today I'd like to talk to you about one of the most important systems in your body, your digestion, your assimilation, and your elimination. And even more importantly, how to keep those systems and organs clean, toned, and working great so you stay at your optimum health. My 8 clinical herbal formula for your digestion and elimination are my intestinal formula number 1, my new intestinal formula number 1, maximum strength, my intestinal formula number 2, my 5-day bowel detox program, my brand new bowel flush shot, my intestinal formula number 3, my digestive tonic, and my new digestive shot. In this introduction, I want to talk to you about some of my personal experiences in life and in the clinic that really brought about my realization for the need for many herbal formula and strong and powerful herbal formula and effective herbal formula to keep your digestion working, your assimilation working, and your elimination working. You know, as a kid, some of my first memories were being horribly constipated. In my household, imagine my mother, my father, me and my brother living. One bathroom was typical in a house in those days, and we had one bathroom, and it was kind of centrally located in the house. So when you went to the bathroom, pretty much everybody knew about it. And I used to remember my dad going in there only about once a week and taking sometimes the Sunday newspaper with him, and he wouldn't come out for an hour or hours. And when he came out, it smelled like death in there, and there was almost a green cloud floating around in the house. And I remember my own bowel experiences being about the same. I remember that I would have one bowel movement a week, usually on a Saturday or Sunday. I don't know why I timed it that way. And it would be very hard, very black, little hard marbles or logs. I almost felt like they were going to chip the porcelain on the toilet when they came out of me. And my brother was horribly constipated too. And we had this great German family of constipation, probably due to our food program that almost had zero fiber in it because of the amount of animal food in it. We had blood for breakfast, lunch, dinner, and dessert. But then when I was old enough to go to school, it didn't get much better. In school, I remember having to raise one finger if you wanted to go pee and 2 if you had to go have a bowel movement. And anybody who raised 2 fingers was a jerk, and all the kids laughed. So I learned early on in kindergarten and first grade, never, ever raise 2 fingers. So you'd lie, go to the bathroom, have a bowel movement, but God forbid you had any gas or any noise in that bathroom that just happened to be located beautifully right inside the classroom, right off the classroom, a door. If you had any gas or smell, well, you were ostracized and pretty much no one would talk to you for at least a good week. So I learned as a kid, survival was never having a bowel movement in school. And you know, as you get older, it doesn't get much better. We go around and look for bathrooms and public restrooms when we're out and about, and there's very few. There's little or none. Often you go to a restaurant and they say, well, you can only use the bathroom if you eat here. And God forbid, if I ate at most of these restaurants, I wouldn't have to have a bowel movement. So it really doesn't get much better as an adult. But enough about me. Let me tell you some stories from my clinic, from the first year of my clinical practice, my clinical experience, that really taught me about the importance of keeping a healthy digestion and keeping good elimination and staying away from the doctors and their knives. You know, in the first year of my clinic, a woman came to see me. She was having some real horrible problems with menopause and also with depression that kind of came with her menopause. But in the first visit, talking with her, I could feel that there was something more. And she started telling me a story about her young daughter. Her daughter had been horribly constipated as a baby and as a toddler and as a kid. And as she got older, her daughter's constipation just got worse and worse. And eventually, around the age of 11, she wouldn't have any bowel movements at all. They had to take her to the hospital and to the doctor's office to actually have enemas, and sometimes to get the fecal matter, the dried, hardened fecal matter, literally pulled out of her by the doctor. It was a horrible story, and she was in a lot of pain and discomfort. She developed some bowel disease because of this, some bowel bleeding. They went in and cauterized some of her bowel, a very horrible and painful procedure. And eventually, the medical doctors suggested that this girl get an ileostomy. Now, many of you have heard of a colostomy, where they remove a section of your bowel and actually put a stoma or a surgical hole on your lower abdomen where you glue a bag for the rest of your life, and then your fecal matter goes into that bag. But for this girl, they suggested an ileostomy, where they take the last part of your small intestine, also called an ileum, and that's where this name comes from, ileostomy, the entire removal of her bowel. And then they would put this bag, attach it to the end of her small intestine, where much more liquid feces comes out into the plastic bag. Of course, the family was horrified, but the doctors suggested that it wasn't that invasive of a surgery and that a lot of people live comfortably that way. So they did perform the surgery. And when that girl woke up in the hospital, well, you can imagine she was horrified, but the doctor said, look, time will heal all things, and in a while she'll feel better. But she went home and she was depressed for months. So the mom, who was in my office with menopause, was telling me that on her 16th birthday, she decided to give her a sweet 16 party and invite all her friends and even buy her a new party dress to lift up her spirits. And she did, and they had the party, and during one of the more romantic moments of the party, this young lady was dancing with her new boyfriend, and she felt something hot, and her bag had come unglued. Her warm fecal contents spilled all over her new dress, her boyfriend. Obviously, she went screaming out of the room, up to her room, crying all night. The party was over, and her mom said, well, I felt she'd be better, by the morning, a good night's sleep. And when her mom went up to her room in the morning, she had hung herself and killed herself. Now, that was one of my first clinical horror stories of extreme constipation. And I just wish I would have been there before that whole medical nightmare had happened. But I wasn't. Life is so wonderful, and it presents you with so many great blessings and opportunities. And as it happened, the very next week, parents of an 11-year-old boy called me who was severely constipated. In fact, he was so constipated they couldn't remember when he had his last bowel movement, and he was scheduled for a colostomy surgery on that Thursday. The doctors were going to surgically remove his bowel, and here it was Tuesday morning, and they said, Dr. Schultz, is there anything you can do? And I said, absolutely, bring him in and come in here as soon as possible, and they made an appointment for that afternoon. And I went to my library and I started studying my old veterinary herbal books about the bowel that had all sorts of herbs that were used on horses and even elephants that were constipated, because I knew I needed something strong for this kid. And I mixed up a formula. The kid took it that afternoon and evening, and the next morning the parents called me and that kid had a bowel movement. Now, they said it was so long in the toilet, it reached from their fingers to their elbow, about 18 inches long, and they said it was so hard that they couldn't flush it down the toilet. The dad had to go out in the garage and get a shovel and chop it up so they could flush it down. And to this day, that kid's bowel works great, and I think about how his life would have been ruined if the medical doctors would have removed his bowel, and all we needed was a little common sense and a handful of herbs. After that experience, I got a flood of calls from hundreds and hundreds of people over decades in my clinic, from babies to the elderly in nursing homes. In fact, I had one baby that was brought to me that was only a few months old and was diagnosed with having Hirschsprung's disease, which is a disease where the nerves are not supplied to the bowel and the bowel doesn't work at all. And the parents asked me if there was anything I could do because they were going to perform a bowel surgery and a colostomy on a young baby. Can you believe that? And I said, absolutely. And I had this kid brought in, and I had them use herbs on this kid, and sure enough, well, this kid's an older person now and has plenty of bowel movements, and I was able to help them save the bowel of their baby. All the way to the elderly. I've had many people call me that parents and grandparents are in nursing homes, and because of the sedate lifestyle and the horrible food usually in those facilities, their parents and grandparents can't have bowel movements and were scheduled for bowel surgeries, and I was able to help them save themselves too. You know, in the past, many times in videos and writing, I've referred to the AMA as the American Murderers Association. Now, okay, I'll apologize to the few medical doctors out there who are great. But the reality, and the reason I called the AMA that, is because if you would have spent any amount of time in my clinic, especially the decades I did in my clinic, and saw the cutting and deforming and mutilation and burning of organs out of the body that ruined people's lives to where they committed suicide or never went on a date and lived alone in their house, to where they were in pain for the rest of their life, when all that was needed was a little common sense and a few herbs. Believe me, the medical system in America is not doing us any favors, especially when it comes to our digestion, assimilation, and elimination. So if any of you out there are considering any type of surgery, whether it's a colostomy or an ileostomy or any surgery, if it's a hysterectomy and any of you women are considering sterilizing yourself, don't do it. Or even a tonsillectomy, removing your tonsils, probably the cause of the entire polio epidemic in the first place. But stop. Stop cutting yourself. Stop disfiguring yourself. It's not necessary. And that's partly what this video is about, especially if you're thinking of a bowel surgery. Don't do it. The next part of this video is going to help you. Okay, I know that some of you out there, like my patients, think that you're an exception to the rule, or that you're different, or that maybe I didn't see anybody as sick as you, or as constipated as you, or with as bad digestion, or maybe you think because you have Crohn's disease or colitis or irritable bowel system or gastric ulcers or gastric reflux or hyperacidity or whatever, that you're an exception. You're not an exception to the rule. I saw every type of digestive assimilation and elimination complaint possible in my clinic over the decades, and I saw a lot of people a lot worse than you. So let me tell you about a few of them. You know, when I was studying before I opened my clinic, my great teachers told me about people in extreme cases that only had one bowel movement a month. But I thought that maybe these were fish stories, you know, they exaggerated a little bit. But lo and behold, in the first month of my clinic, I had a model, 5'8", good looking, about 110 pounds, come to see me. And you can imagine how my jaw dropped when she told me she only had about one bowel movement a month when she had her period with her menstrual cycle. And I thought, wow, my teachers were telling me the truth. This is amazing. But soon after that, a 38-year-old woman, an attorney, came to see me. And she was only having one bowel movement every other month. That's 6 bowel movements a year. But that record was soon broken by Teresa from Santa Rosa, California, who came to see me, who only had 5 bowel movements in a year. In fact, that year she was pregnant, and she only had 3 bowel movements during her entire pregnancy, 1 per trimester. Imagine what that child was surrounded with. But sure enough, that wasn't it. Because a few years after that, I had a woman in my clinic who only had 2 bowel movements in a year. Now that's extreme constipation. I'm surprised she was alive. And all of these people, I helped them have normal bowel movements by just using a few herbs and changing their food program and moving a little bit, and I'll get into those in a minute. 2 last record breakers. I had one man that was doing my bowel detoxification program in Hawaii, a Hawaiian man. And overnight, he eliminated 56 pounds of fecal matter. That's right. When he weighed himself in the morning, he was 56 pounds less. Now, he had worked himself up to 46 or 47 capsules of my intestinal formula number 1, and finally, he got the waste out of him. I had another woman that started at 410 pounds, and after a year on multiple bowel detoxification programs, she went down to 180 pounds. That's over 200 pounds she lost, and a lot of it was fecal matter. Now, most of you are not going to be any record breakers, and you're not going to beat the majority of people that I saw in my clinic that were ill. But you do have digestive, assimilation, and elimination problems. And this is what this video is about. Now, even if you think you're okay, the statistics, the medical statistics say you're not. First off, you must understand that colon rectal cancer is the #1 fastest growing cancer in America. And it's the #1 cancer among men and women. That's right. Much more than breast cancer in women, much more than prostate cancer in men. And of course, those two cancers, maybe because they're sexy to talk about, are the two talked about cancers in America. But many more people get and die from colon rectal cancer. And I know we hear a lot about AIDS, but 400% more people die from colon rectal cancer than from AIDS. But according to medical statistics in the medical books, every American, as they get older, will have some type of bowel disease. Now, let me give you those statistics from my book, but they're out of the Merck Manual, one of the standard medical texts for disease diagnosis and prognosis. In 1950, 10% of Americans were found, over the age of 45, were found to have diverticulosis. In 1955, that went up to 15%. In 1972, it went up to 30%. In 1987, it went up to 45%. And in the 1990s, they stated that every person will have diverticulosis in America if they live long enough. That's every person in America, if they live long enough, is going to have bowel disease, is going to have diverticulosis and bowel polyps. Now, let me tell you what they are. Diverticulosis are small saccular herniations in the wall of your colon. They're caused by constipation and gas, or pressure from within your colon. Now, if 100% of us, that's all of us, have diverticula or diverticulosis or herniations in our bowel caused by the internal pressure and buildup of fecal matter by constipation, I would suggest that all of us to some degree are constipated. And these diverticuli are filled with old fecal matter that gets infected. And when they get irritated, it's called diverticulitis. And this can lead to serious bowel disease. And of course, this constipation can also cause mutation of the cells in your bowel, which causes bowel polyps. Now, sometimes they're benign and sometimes they're not. Sometimes they become malignant and cancerous, and often bowel polyps turn into malignant cancer in your bowel. So the constipation or the storage of old, toxic, poisonous fecal matter in your bowel causes everyone to have constipation to some degree, backup of fecal waste to some degree, and eventually herniations or diverticulosis and possibly bowel polyps. This is not good. So here's a good question. What's normal? What's healthy? How often should you have a bowel movement? And what should the consistency of this bowel movement be like? Well, I would highly suggest that you don't look into a health book that maybe your high school student brings home, or even any medical books, because they're going to tell you that it's normal to have 3 to 5 bowel movements a week. Okay, that's what the doctors are telling us. Of course, at the same time, these same doctors are telling us that every American, if they live long enough, is going to have bowel disease. So I think that their ignorant, stupid advice on how often we should have a bowel movement is wrong. It doesn't make sense, because if that's correct, then why do we all have bowel disease? So obviously we need to have more than 3 to 5 bowel movements a week. Now, to discover what's normal, well, I traveled a lot around the world and studied primitive people and some of their bowel habits. Now, how many people do you know that can say that? Anyway, what I saw is that in most areas of the world where people are living naturally or primitively and eating high fibrous foods that grow in their area in season and get plenty of exercise and have very or little stress, that these people had 1 bowel movement a day for every major meal that they ate. So if they ate 2 major meals, they had 2 bowel movements a day. If they ate 3 major meals, they had 3 bowel movements a day. And usually those bowel movements were within 30 minutes after they finished a meal. Because when you eat food, the digesting and assimilation of that food triggers muscular action called peristalsis in your bowel, which causes previous meals to be eliminated. So what should your consistency of your bowel movement be like? Well, it shouldn't be hard, packed granite balls that I described like I had when I was a kid, or hard logs, but it should be soft. It should have a soft peanut butter-like consistency, because it shouldn't be sitting dehydrating in your bowel for days. It should be moving quickly and efficiently through your digestive tract into your colon to be eliminated. So in order to have normal, healthy, frequent bowel movements with a good consistency, I needed help. And my patients in my clinic needed help. And so we turned, like many people do, to the drugstore and were horrified with the results. And many people even turned to using herbs. But I found that most of the herbal formula on the market, especially for constipation, were antiques. I mean, there's a formula out there, it used to be called Interclean, that was designed by a man in the 1800s. I think he used this on Buffalo Bill and Wyatt Earp, but it was certainly not something that works today. In fact, many of the bowel formula on the market today, the herbal bowel formula, were designed in the 1950s. And in the 1950s, well, that was a very different time. There wasn't a fast food, fiberless junk food meal available on every corner of every major intersection in America. People ate differently. They moved differently. They weren't as sedate. They had less stress. So the formula that are available just don't work. That's the bottom line. Because today we're eating more garbage junk food than ever before in history. It has less fiber because of our higher consumption of animal foods than ever before in history. We get less movement than ever before in history because of computers and working at desks and modern transportation like automobiles. We don't move our body, so we have less bowel movements, and we have significantly higher levels of stress than 100 years ago. Did you know that if you read a newspaper in any major city for a week, that's the entire amount of information that anybody knew in their entire life 100 years ago. So don't try to tell me we don't have higher levels of stress now than ever before in history. So because none of the herbal formula worked for me or my patients in the clinic, I decided I had to start making my own much stronger, much more effective herbal formula like I talked about when I designed the one for that young boy who was 11 years old who was headed for surgery, and I had to stop that from happening. So I started using herbs for the bowel that were much stronger than what's been used in the last 100, 150 years. Again, some of these herbs were only used on large animals that were constipated. Now, some of you ask, what's the first detox I should do? Because I'm going to get on a health program. I'm going to start shopping more in a health food store and eating more fruits and vegetables and grains. And I want to get healthy. So I want to do a detox. It is always the same answer. you start with the bowel. And the reason is just simple and makes common sense. Because any detox or cleansing program or any flush program, the whole idea is to pull toxins and poisons and waste out of your body, out of your cells, out of your fat cells, out of your tissues, and out of your organs that is accumulated in you so you don't poison yourself and you don't get sick. And whenever you do any type of cleanse or detox or health program, this puts waste material inside your bowel. And if you are constipated, you are going to feel horrible. You've heard many horror stories, or at least a few of them out there, from people who did a health cleanse or a detox program, and they felt horrible. They felt like crap. Well, that's why. The first thing you have to make sure is that your bowel is working efficiently and effectively, and that you're eliminating your fecal matter frequently, multiple times a day. That way, when you do any other type of cleanse or detox or health program, and you're pulling poisons out of your fat and muscles and different organs of your body, and they're going into your bowel, they will get out quickly. You won't be reassimilating them. You won't be dragging these poisons back into your body. You'll be getting them out. So the first detox, the first cleanse you should always consider is a bowel detoxification program. And if you've done many cleanses, but you're starting again, or you haven't done one in a while, always start with the bowel first. Bowel cleansing is first. Getting your bowel working better and more effectively and more efficiently is first. Finally, in my clinic, many people came to me with, you can imagine, every health problem, every disorder, every illness, every disease known to man. There isn't anyone with any disease that I haven't heard of and that I haven't dealt with. What is amazing, though, is how a constipated, plugged bowel filled with fecal matter can cause so many seemingly unrelated diseases and illnesses in the human body. I had people, because in my clinic the first thing I did was I cleansed their bowel. I got their bowel working. I got the old fecal matter out and that bowel toned and strong and working. And then I was going to deal with the rest of their health problems. But the amazing thing that I discovered was with the majority of my patients, once their bowel was clean and working and all that toxic waste was out of them, their disease went away. Their illness went away. Their complaints, their symptoms, their problems went away. Everything from menopause and lower back problems to digestive problems to heart problems to nervous system problems to diabetes. You would be amazed. I had people with clinical depression that weren't depressed anymore. And how is this possible? Well, think about it for a minute. The bowel is a huge organ, and imagine it being impacted and constipated with fecal waste. That's going to press on everything. Your uterus is surrounded by your bowel. Imagine how it's going to feel when you have your period or your menstruation if that uterus is collapsed because of all the fecal matter and waste in your bowel that's pressing and crushing onto that uterus. It's not going to feel good. Clean the bowel and menstrual problems go away. Fertility comes back. Sexuality increases. Okay, and for you men with the prostate, it's no different. It lies right on the rectum. In fact, a prostate biopsy is done through the rectum. It's right there. And I'm talking about your kidneys and your bladder touching the bowel. Most of the organs, most of the major organs in your body, your liver with liver diseases, and your pancreas with diabetes and digestive diseases, and your lungs and your heart, they are all touching to or near your bowel. And if it is loaded with fecal matter and expanded and impacted, it's pressing on these other organs. They're not going to work as well. And even if it's not touching the organ, like your brain, that waste is reabsorbing back into your bloodstream. So you're just not going to have any sweet thoughts on a sour stomach. You know, I had many, many people with depression and anxiety, and it all went away when they did a thorough bowel cleansing. It's amazing, but it's true. Finally, I'd like to give you 6 healthy, natural ways that you can get your bowel working better again. And the first one is simply drinking more water, drinking more liquids. You know, once your food is digested in your stomach and assimilated in your small intestine, it moves on to your large intestine, often called your colon or your bowel, in your large intestine. And there, one of the major jobs of the large intestine is to absorb water back into your body and dry up the contents that are coming from your small intestine, which are very slushy and very wet, and to dry up your waste a little more before it's eliminated to absorb the water. So one of the main reasons for constipation is just dehydration. People don't drink enough water and enough liquids. Did you know that you need to drink a minimum of 64 ounces, fluid ounces, that's 2 quarts of liquid a day, just for your bowel to function normally? Otherwise, your fecal matter will get too dehydrated and it causes constipation. The number 2 way to get better bowel movements is to eat more fiber. Did you know that one of the main things in the American diet is animal food? And any meat, any animal's flesh, any animal's eggs, any dairy products has 0 fiber. Absolutely none. The only fiber that exists in food comes from vegetables, fruits, grains, nuts, and seeds. That's right, vegetarian food is loaded with fiber. So because of the high amount of animal food and dairy products and eggs in the American food program, there's not enough fiber, and fiber makes you have a bowel movement. So eating more fiber and cutting away or cutting out the animal food will help you have better bowel movements. The number 3 thing you can do to have better bowel movements naturally is eat more laxative type foods. And those would be foods that contain water, like fruits. We all know that apples and plums and figs and prunes and those type of foods will help you have better bowel movements. But almost any fruit will help you have better bowel movements, and vegetables and grains. I'll tell you something. Go on a diet for a couple weeks of just raw food, or even a vegetarian food program of vegetables, grains, and fruits. And you are going to be amazed at how well your bowel will work in just a couple weeks on that food program, cutting out all the constipating foods. And remember, cut out your bread too. When I say grains, I mean whole grains. I don't mean eating bread, because bread is very constipating. In fact, wallpaper paste, I don't know if any of you have ever tried to remove it from a wall, but you almost need nuclear fusion to do it, to remove wallpaper. Wallpaper paste is just made from wheat paste, so it glues onto the inside of your bowel. So stay away from refined wheat products, breads. Stay away from your animal foods and your eggs and dairy products, and increase your veggies and grains and fruits and nuts and seeds. And the next thing you know, your bowel's going to work wonderful. It's going to make an amazing difference, and your constipation will probably be gone. The number 4 way that you can help your bowel be more regular and have more frequent bowel movements is to move your body. Come on. Nowadays, we move less than ever before in history. Look, anytime we want to go anywhere, we get in a car, we get on public transportation. We don't walk anywhere anymore. And when we finally get there, when we've walked somewhere, usually we sit down. And nowadays, with the computers and the desk work, very few people are getting enough exercise. And just moving your body causes peristalsis, or causes the muscular contractions in your bowel that create a bowel movement and elimination. So we all need to move more. Number 5, emotions. Did you know that negative emotions constipate you? Positive emotions like happiness, love, joy, bliss, laughter, all those emotions help you have more bowel movements. But anger and fear and negativity, well, I used to say in my clinic, nothing positive ever comes from being negative. I'll repeat that. Nothing positive ever happens when you're negative. So get positive, start laughing more, learn more jokes, have fun, be loving, be kind, be blissed out, and your bowel's going to work a lot better. And number 6, Herbs are amazing at fixing any disorders, any illness, any dis-ease of your digestion, assimilation, and elimination. And in the next part of this video, I'm going to talk to you about my 8 clinical herbal formula that I designed to fix everything that can go wrong from your mouth to your anus, and especially all the parts in between. So let's talk about the first formula, intestinal formula number 1. This formula I designed in my clinic decades ago, many years ago. In fact, it was one of the first versions of it that I was talking earlier about, that 11-year-old boy that came to see me that was headed for bowel surgery, and I needed to stop that from happening by getting him an herbal formula that was strong enough to make even the most severely constipated person have a bowel movement. Well, that was one of the earlier versions of this formula. But over years in the clinic, I refined this formula to do one thing: stimulate your bowel to work more often and more completely. The bottom line, pun intended, is that this formula, intestinal formula number 1, is going to cause your body to have more bowel movements more completely and more frequently. It's going to make you have more bowel movements. And again, according to modern medical texts, everybody in America is suffering from diseases because they're constipated, because their bowel isn't working enough. Intestinal formula number 1 makes you have more bowel movements. That's what it does. What's in intestinal formula number 1? Well, 8 very important and very effective herbs. The first ones are curacao and Cape aloes. These are an equatorial version or variety of aloe vera, but much stronger. Aloe vera, as all of you know, we commonly use it for sunburns and to aid our digestion. But these equatorial aloes, sometimes referred to as aloes spicata or aloes ferox, contain much more of the anthraquinone, which is called amodin, which causes you to have peristalsis or muscular contractions in your bowel. Aloes, Cape, and curacao are one of the most effective, one of the strongest herbs on the planet to create your bowel to have muscular movement, which causes you to have a bowel movement. Another herb in the formula is senna. I use both the leaves and the pods of senna. Now, senna has been used for thousands and thousands of years. It used to grow in the Nile Delta in Alexandria. In fact, the old senna used to be called Alexandrian senna. And senna, again, contains the anthraquinones, amodin. So it's a very powerful herb like aloes at causing the muscular contractions in your bowel. And the third in this group is Cascara sagrada, which comes from the Pacific Northwest in the Americas. So popular with the American Indians, they called it sacred bark. They thought it was a sacred plant. Obviously, they knew that helping you to have a bowel movement could help heal just about anything that was wrong with you. Many people that came to me in the clinic, I needed to get them to have a bowel movement right now, immediately. Well, not exactly in that moment, but by the next day. And I couldn't necessarily get them to follow the good food program or the exercise program or become a positive thinker overnight. Of course, I wanted them to eventually do all of that, and I put them on programs to do that. But I needed their bowels to work the next day. And these bowel herbs, these anthraquinone herbs, work directly on the tissue of your colon to make it move. They're very effective. In fact, in naturopathic school, we used to take these herbs and rub them on a dissected bowel that was removed from the human body, and the bowel would still move. Now, I've never tried to have a dead person have a bowel movement, but I almost believe you could, because these herbs, what's important here is these herbs do not require you or your assistance physically, emotionally, or spiritually to have a bowel movement. They're going to make it happen anyway. And that's important because, like I said, I want you to eat right, move right, and think right, but I can't make all those programs kick in 24 hours, but I can make your bowels work in 24 hours. Now also in this formula is barberry root or Oregon grape root, a similar plant. And this plant contains berberine, and it makes your liver purge its bile. So it's mildly liver cleansing, but most importantly, bile is a natural laxative. Once it goes through your gallbladder or your bile ducts or your common bile duct and gets into your duodenum and gets into your colon, it has a natural laxative effect. But cleaning your liver is a good part of a bowel cleanse. There's also ginger in this formula, very important. The Chinese call ginger the downward herb. And ginger is there to keep everything moving downward. You have peristalsis when you eat, from your mouth when you chew food to your esophagus that has muscular waves that moves the food down to your stomach that compresses to digest the food, to your small intestine and all the villi that absorb it, to your large intestine, finally eliminating out. And ginger keeps the peristalsis going and keeps it moving downward and not the other way around. So an important herb in this formula also is a carminative. Ginger helps with gas. And anytime you're cleansing your bowel and maybe removing old fecal matter out of any diverticuli or nooks and crannies you have, you can get gas. And ginger relieves the gas and moves it out of your body. There's also garlic in the formula, and garlic has been used for thousands of years, since the beginning of time, as far as anybody knows, as an effective herb for destroying any bacteria, any virus, any fungus, any antigen, any pathogen, anything inside you that can hurt you. Garlic will get rid of it. And this is really important in a bowel cleanse, because you can imagine when you're removing old fecal matter, what might be underneath there, the pus, the infection. Not so good. You want garlic in there, because garlic is our strongest and most effective infection fighter. And finally, there's cayenne in the formula, but not just cayenne. I use habanero peppers. And the reason I use them is they're the strongest. And what the cayenne does is it also stimulates your bowel to work better, but also it's common to have bleeding in your bowel, especially if you've been constipated. And this bleeding will be stopped by the cayenne in the formula. So here you have it. Cape and Curacao aloes, senna leaves and pods, and Cascara sagrada, all to create you to have more peristalsis. Barberry or Oregon grape to flush your liver, to purge more bile, a natural laxative. We have ginger in there, which relieves the gas. It's a carminative in case you have gas while you're cleansing your bowel. We have garlic in there to destroy any infection that may be present with this old poisonous and toxic fecal matter. And finally, cayenne, not only to stimulate your bowel, but to stop any colon bleeding. Okay, the dosage of your intestinal formula number 1. It comes in capsules only. There's 90 caps in a bottle. And this is very important. Listen to me. Unless you want to discover the laws of jet propulsion in your bathroom, you start with 1 capsule. I don't care how constipated you are. You start with 1 capsule with or just after dinner. Is the best time to take it, with a little food in your stomach, and just see what happens the next morning. You know, most of us have taken years and years, if not decades, to make ourselves sick and be out of balance or become diseased and ill. Decades. So I don't want you trying to fix yourself overnight and rushing into any of these bowel formula. So start by taking 1 capsule with or just after dinner with a little liquid and see what happens in the morning. Hopefully, you'll feel the need to go to the bathroom, have a bowel movement. You'll sit down on the toilet and you'll go, wow, that was wonderful. I haven't had a bowel movement like that in a long time, maybe in years, maybe in ever. Okay, and you're going to say, this is great. And that's what this formula is supposed to do. You shouldn't have to push. You shouldn't have to strain. You can get rid of the library of books and magazines in your bathroom, because you're only going to spend a minute or 2 in there. You're going to sit down and go, clean up, and be out of there. Now, if that doesn't happen the next morning, then the following night, take 2 capsules with dinner or just after dinner and see what happens the next morning. And if that doesn't happen, the next morning, increase your dosage. Take your time. You don't want to start out with 5 or 10 capsules because I don't know what your dosage is. I don't know how your body will respond. So relax a little bit and increase by 1 capsule every day until the next morning you go, wow. Maybe you had to run a little bit on your way to the bathroom and go, wow, I feel something coming on. And when you sat down, you had a great bowel movement. And that's your dosage. Then stay on that dosage for a period of time. Don't back down. Stay on that dosage. What you're doing is you're training the muscles of your bowel to get stronger. You know, when you go to the gym, you don't get weaker, you get stronger. When you do an isolated bicep curl, that makes your bicep stronger. By constantly increasing the peristalsis, the muscular contraction of your bowel, I'm making your bowel muscles stronger. So stay on this formula for at least a few weeks, if not a month. I used this formula for over 10 years. Before my bowel naturally worked well on its own. And many of my patients even used it longer. Some of them still use it. So don't back off. When you find the dosage that helps you have a great bowel movement the next morning, stick with that dosage for a while. Finally, one thing I heard from all my patients and I hear from all my customers is fear. Fear, 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 fear. What everybody should be afraid of is getting diverticulosis, getting polyps, getting bowel disease. That's where our fear needs to be. I talked about it being the #1 fastest growing cancer among men and women today in America. We don't need to be afraid of getting our bowel working. But I get so many questions about, can I become addicted? Can I take it too long? What happens if, suppose I can't get to the bathroom, suppose I can't find a bathroom? Quit whining, okay? This video and these formula are about you changing your life and getting well, period. Bottom line, that's what this video is about. So I want you to start taking your intestinal formula, increase by 1 every day. Use your good common sense, okay? If you have a long drive to make and it's 3 hours long, maybe postpone that drive or start your bowel cleansing another time. I suggest to postpone the drive. You're not going to have an accident, but the reality is your bowel's going to work better. In fact, it's going to work better than it ever has. Here's one more thing. If you have an old car in your garage and you go out to start it, and you haven't started that car in years, do you think it's just going to turn over and hum and run smoothly? No. Maybe you're going to have to crank it a while. Maybe it's going to backfire through the exhaust or through the carburetor. Maybe the engine's going to shake a little bit and smoke a little bit. If you've been constipated for years, don't expect a miracle the next morning. Your bowel may backfire and shake and smoke a little bit. You know what I mean? It might not be perfect. You might have a little excess gas. You might have a little rumbling. You might even have some very slight pain, especially if you've been severely constipated. But this will go away quickly. Remember, start with 1 capsule and increase by 1 capsule only every day until the next morning you have a great bowel movement. Trust me, try this formula. You're going to send me a letter too, telling me how much you love it, telling me how much you love me. Next, I'd like to introduce one of my new formula, intestinal formula #1, maximum strength. It is what it is, my friends, a much stronger version of intestinal formula #1. This is for people that are much more constipated or severely constipated. It has many of the same herbs that are in my now famous intestinal formula #1, but just more of them. More of the Cape and Curacao aloes, the senna leaves and senna pods, and more of the Cascara sagrada, all the herbs that create peristalsis or the muscular contractions in your bowel. More ginger, because if you have a stronger formula, you need more carminative or gas-relieving action, and the habanero pepper. It's similar in action to my intestinal formula #1, just stronger. Now, how do you take it? exactly the same way as you use my intestinal formula number 1. The dosage would be 1 capsule with or just after dinner with a little bit of liquid, and then see what happens in the morning. If you don't have a wow, go up to 2 capsules that evening with dinner and keep increasing your dosage by 1 capsule a night till when in the morning you have a wonderful, complete, easy bowel movement. So remember, start with 1 capsule and increase by only 1 capsule daily until you reach your proper dosage. And then once you reach your dosage, stay on that dosage for a week, 2 weeks, a month, a year, whatever it takes to get the muscles stronger in your bowel and to get your bowel working more frequently, to get your bowel working normal and healthy. My next herbal formula is intestinal formula number 2. It's called number 2 because it goes along with number 1, but it's the second formula you would use. The first most important thing is getting your bowel to work more frequently, more often. And that's what intestinal formula number 1 does. Intestinal formula number 2 is the second formula to go in and remove the old waste that might be stuck in your bowel. Now again, according to the Merck manual, every American, if they live long enough, has diverticulosis. And remember, diverticulosis are small saccular or sac-like herniations in the wall of your bowel that were caused by constipation and gas. And remember that these herniations are filled with something. Guess what? They're filled with fecal matter. So part 2 of cleansing your bowel, first part is getting it working more often. Part 2 of cleansing your bowel is getting rid of the old, toxic, poisonous, infected waste that's stuck in these saccular herniations or any nooks and crannies inside your colon. This is step 2, and this is where intestinal formula number 2 comes in. Now I'm going to tell you what intestinal formula number 2 does. But to better explain it, I'm going to tell you about all the ingredients in it because each of the herbal ingredients does something a little different. To start with, the formula contains pharmaceutical-grade bentonite clay. Bentonite clay simply draws 40 times its weight in material, absorbs 40 times its weight of material out of your bowel. It's very similar to doing a clay mask on your face, but I'm doing one on your insides, inside your bowel. And when the bentonite clay lies against your bowel, especially against any of these diverticuli, it draws out the old toxins, the old poisons, the old fecal matter, the old waste, and absorbs it into this formula to be removed by your bowel. So the bentonite clay absorbs 40 times its waste. It's amazing. In fact, the clay I use in this formula is so powerful that once I put it on my face for a face mask, and I felt like it was going to suck my brains out through the pores of my skin. So I don't suggest doing that. But it's a powerful pharmaceutical-grade bentonite clay. The next ingredient is activated willow charcoal. Now, we all know that charcoal absorbs poisons. That's why it's inside of every water filter, because we know that it absorbs up to 3,000 or more known chemicals, insecticides, pesticides, heavy metals, toxins, poisons, you name it. Charcoal is our greatest gift as an absorber. And activated willow charcoal is as good as it gets. And so this is going to collect and absorb and neutralize and render harmless just about any known poison, toxic chemical in your bowel. The next ingredient in the formula is apple fruit pectin. Pectin naturally occurs in many fruits like apples and grapes, and it's a very magical ingredient. One of the reasons they say an apple a day keeps the doctor away, or grapes have been such an important part of cleansing and detox programs, is because pectin absorbs heavy metals like mercury and lead and even strontium-90 and radioactive material. Now you might say, why do I need that? Well, just about every fresh fish and seafood tested today contains toxic levels of mercury. That's right. And even if you don't eat fish, most everybody's had amalgam fillings that were loaded with mercury. And if you don't have any fillings in your teeth, almost everybody's been immunized, and everything from childhood immunizations to flu shots contain toxic mercury that was put in there as an additive and preservative. So we're all infected with mercury in our bodies. Also lead. Lead exposure was everywhere. When I was a kid, they made Christmas tree tinsel out of lead and paint out of lead and pencil lead out of lead. And still today, we have lots of lead exposure, and that causes nerve damage and cancer and destroys your body, and heavy metals need to get out of you. And lastly, radioactive exposure. We've all had dental x-rays, chest x-rays. Nowadays, you get, the new high-tech names CT or CAT scans or MRIs, but let me tell you, most of them are equal to 200 regular x-rays. And forget our microwave ovens. I can go on the list from luminous dials on our clocks and watches. We got everything surrounding us and around us that's giving us radiation. And so remember, fruit pectin absorbs and removes mercury, lead, strontium-90, and heavy metals from your bowel and from your body. Intestinal formula number 2 is also soothing, very soothing to the wall of your bowel. And to make that happen, I put in flax seeds, which contain an oil that has lots of omega-3s and omega complexes in it, which are anti-inflammatory and soothing to your bowel. That oil comes right out of the seeds. But I put the whole seeds in the formula because once the seeds are cracked, they go rancid. But the whole seeds, the minute they get in your digestion, start emitting that oil. I also have marshmallow root in the formula, and marshmallow root is very mucilaginous. It soothes irritated and inflamed tissue. I also have slippery elm inner bark in the formula that does the same thing. It also contains psyllium seed. Psyllium seed is from the plantain family, and it's an amazing herb. It's a bulk herb. It holds water and adds bulk to your stool and helps all these other herbs pull the poisons and toxins out of your bowel. Now, it also contains a little bit of peppermint and cayenne. And the peppermint is in there simply for your digestion, and the cayenne to stimulate blood flow and help all of this material come out of your bowel. Now, I haven't showed it to you yet because it comes in many forms. The first being my intestinal formula number 2 in the bulk jar. This jar is just filled with a powder. The second is my intestinal formula number 2 in packets. This box contains many of these packets of intestinal formula number 2. The third is my intestinal formula number 2 capsules. Why did I make this formula in more ways available to you than any other of my formula? To get you to use it. This is so important. It's part 2 of cleansing your bowel. Remember, Formula 1 is to get your bowel working more muscular movement. Formula 2 is to absorb waste, absorb poisons, absorb toxins, absorb heavy metals, absorb old fecal matter that's inside you, an old infected material that's inside you, to soothe the inside of your bowel, to soothe your mucous membrane lining of your colon, and then to get this material out of you once it's absorbed and you're soothed. So it's a very, very different formula. Let me tell you about the dosages that you would use when taking my intestinal formula number 2. First off, if you're using the intestinal formula number 2 in the bulk powder form, you want to take 1 rounded or even heaping teaspoon 5 times a day for 5 days. That's 1 heaping teaspoon 5 times a day for 5 days. Now, the best way to do that is to use an old recycled peanut butter or pickle jar. Wash it out really good. And then in the bottom of that jar, put about a ½ inch to an inch of liquid. It can be water or juice. Then take your heaping teaspoon of intestinal formula number 2 and put that on top of the water. It'll kind of float on top of that water or juice. Then add an additional 12 ounces, because you want about 12 ounces more of water or juice or a water and juice combination. It doesn't really matter. We're mainly looking for liquid. About 12 to 14 ounces of liquid. Now just shake it up. And as you shake it, you'll see that powder begin to dissolve and mix with the liquid. Also, by not putting the powder in first and then pouring in your liquid, I find that when I do that, the powder sticks to the bottom of the jar. So add that ½ inch or inch of water first, then put in your heaping teaspoon of the powder, then add in about 12 ounces of water or juice, or 6 ounces of water and 6 ounces of juice, but get about 12 ounces of liquid in there. We mainly are looking for that amount of liquid, and shake it up. And when you shake it up, you'll see it mix up, you'll see it blend in, and then drink it down once you've shaken it for, about 30 seconds. Just drink it right down. It doesn't have much of any flavor at all. You'll notice it has a little bit of a thicker consistency because some of the mucilaginous and gelatinous herbs in it. If you don't want to measure your intestinal formula number 2 and you want something a little more easy, you can buy my intestinal formula number 2 packets. Inside this box is 25 of these single dose packets, and the packets are designed to use 5 a day for 5 days, the same as if you were measuring the rounded teaspoon of the powder. So you do it the same way. You make it the same way in the jar with a little bit of liquid, then shake your packet, open it up, pour the packet in the jar, add your 12 ounces of water or juice or water-juice combination, shake it up. Same exact way. The only difference is instead of digging into your bulk powder to get a rounded or a heaping teaspoon, all you do is use the contents of one of these packets. Same formula, same way to take it, same way to mix it, same way to drink it. It's just it's coming pre-measured for you in convenient packets. Now, some of my patients didn't want to drink my intestinal formula number 2 drink. And for those who didn't want to do it that way, I put the formula into capsules. With these capsules, to get the same dosage, you need to take 10 capsules. 10 capsules equals 1 packet equals 1 heaping teaspoon of the powder. So you take 10 capsules 5 times a day. That's 50 capsules a day for 5 days. That's consuming this entire 250 capsule jar. So you want to consume either this entire bulk jar, all 25 packets, or this entire jar of 250 capsules. Either way you do it, you're going to get the same amount. But with the capsules, you want to swallow 10 capsules 5 times a day. Now, it's very important, this is very important, that after that you consume that same 12 to 16 ounces of liquid. Don't just swallow these capsules with a few gulps of water because they need the liquid to work. They need the liquid to work. So make sure that with every dose of 10 capsules that you swallow of the intestinal formula number 2, you follow it up with at least 12, if not 16 ounces of water, juice, or herbal tea. Very important. Don't forget that. Now let me tell you a few exceptions to the rule for intestinal formula number 2. First off, 5 times a day, taking either a heaping teaspoon 5 times a day for 5 days, or 1 packet 5 times a day for 5 days, or 10 capsules 5 times a day, or 50 capsules a day for 5 days is my minimum. You can take more. Often I like to do double that dosage. I say, let's have a double. I like 2 heaping teaspoons of intestinal formula number 1 in my liquid drink. Just drink more liquid afterwards. Or I like 2 packets in my liquid drink. Or I like to take 20 capsules. You know, people are always like, oh my gosh, should I take that many herbs? Think about it. Nobody hesitates to ask for a double when they're ordering a martini. I'm saying get a double of your intestinal formula number 2. Sometimes I like to take 10 rounded teaspoons or 10 doses of 10 capsules or 100 capsules a day for 5 days. That just means you're going through 2 jars, bulk jars, or 2 boxes of the packets, or 2 jars of the capsule. But some days I like a double. I feel like I really want to put a larger mass in my intestine to draw out the old poisons and clean me up. So don't be afraid. And there's no rules. Don't get paranoid about it. You might do a double. You might do a single in the morning. That's a nice way to start the morning. Then a double around noontime. Then a double in the afternoon, and a couple singles in the late afternoon and in the evening. But you need to do 5 doses a day. But if you do 6, 7, 8, 9, or 10, it's okay. In fact, it'll just work better. Also, some people out there, I often refer to them as the hot colon type, don't want to use my intestinal formula number 1. They want to use only the intestinal formula number 2. The reason is simple. They're already having enough bowel movements. They may be having too many bowel movements, like irritable bowel syndrome, or spastic colon, or Crohn's disease, or any inflammatory bowel disease that's causing a person to have liquid stools and too many bowel movements. These people don't want to create more muscular contraction. They don't want to use my intestinal formula number 1. They want to start immediately with my intestinal formula number 2, which will reduce the irritation, reduce the inflammation in the bowel. It'll put the fire out. And anybody out there with Crohn's disease or irritable bowel syndrome or spastic colon or hot bowel movements or too many bowel movements, you're going to love me when you take this formula. You're going to go, because the intestinal formula number 2 puts the fire out in your bowel, reduces the inflammation and irritation, and calms everything down. I know your doctor said that there was no cure for Crohn's disease. Well, your doctor's wrong. Try this. Trust me. Finally, intestinal formula number 2, don't leave home without it. It is the absolute cure for diarrhea, for traveler's diarrhea, for dysentery, and I'll tell you why. The medical treatment for diarrhea is to give you something that stops your bowel from working. Now let's back up. The whole reason you have diarrhea in the first place is because you have immune organs in your intestine. That's right, in your small intestine, you have an organ called the Peyer's patches, and in your large intestine or your colon, you have an organ called your appendix. Maybe you didn't know this about your appendix, but your appendix and your Peyer's patches are called immune aggregations. They are a grouping of immune cells that can detect if anything poisonous got inside your digestive tract, like you ate food that was infected with E. coli bacteria, the most common cause of diarrhea in the world, and the most common way that you'll get sick when you travel and get dysentery or diarrhea. So the last thing you want to do is stop the diarrhea. I know it sounds crazy, and I know it would make you more comfortable, but the reason you're having diarrhea is because these immune aggregations have detected bacteria or virus or fungus all the way down in your intestinal tract and in your colon, and their job is to immediately speed up the action of your colon and get everything that's in your digestive tract out of you right now. This is what diarrhea is. The fecal matter is being eliminated before it has a chance to get partially dehydrated, which is what your bowel does. So you have loose, watery stools. It's because you've been poisoned. The beauty of my intestinal formula number 2 is it doesn't stop what your body needs to do, but it does 2 important things. First, it absorbs and neutralizes all the bacteria, the virus, and the fungus, or whatever it is that's poisoned you and is making you sick. And secondly, you'll still have many bowel movements, but the consistency, because of the mucilaginous herbs, will be much nicer than just watery diarrhea. Again, the medical treatment stops your bowel from working, which lets the bacteria or the virus or the infection go nuts, grow rapidly. In fact, the disease loves it if you do the medical treatment. But the natural treatment is not stopping the bowel movements. It's just absorbing the poisons into the intestinal formula number 2. And then when it comes out, instead of it just being water, it's more of a mucilaginous material, and you'll find it much more comfortable. So the absolute antidote for food poisoning and traveler's diarrhea is the intestinal formula number 2. The next formula, actually program, that I want to talk about is my clinical 5-day bowel detox. This is a program that I put every patient on that came to see me, no matter what was wrong with them. Because remember, I talked about how all sorts of unrelated problems and illnesses and diseases can be caused by a digestive system and especially an elimination system that isn't working, by constipation, by an impacted colon, by retaining pounds of toxic waste in your body. So every patient that I ever saw in my clinic, I started them by using this program. And then I would see if there was anything wrong with them when we got done doing a good, thorough bowel cleansing. My 5-day bowel detox includes my intestinal formula number 1. You want to start with this formula and use it until your bowel is working good before you begin my intestinal formula number 2. So remember that. For most people, it takes a few days or a week to get their bowel working really good, and then you bring in my intestinal formula number 2. Now, the 5-day bowel detox kit also includes my intestinal formula number 2. You either get 25 packets of the formula 2 or 250 capsules of the formula number 2, so you can choose whichever way you want to take it. So my 5-day bowel detox is simply using intestinal formula number 1 and getting your bowel working really good, and then bringing in the intestinal formula number 2. Now, for many people, you can do that right off the bat, use both those formulas. And then you're going in and cleaning out all the old waste and all the old debris that can be in the nooks and crannies and diverticuli that is inside your bowel. Now, as an added thing in the bowel detox program, I give you a bottle of the Air Detox. This is mainly for your spouse, your friends, your relatives, your children, or anybody else that might be in the same house you are, simply because often when you're detoxing your bowel, well, some pretty strange odors can come out of you. And finally, in the 5-day bowel detox kit, you get my quick start instructions. These are important because nowadays, one of the reasons often we're constipated is because we're under stress and we don't have a lot of time. And I don't want this to be a burden to you. I want you to be able to do it easily and simply. And this whole program should only totally take you about 5 to 10 minutes a day. So there's no excuse for not doing it. And I include the quick start directions. And then finally in the box, you get a copy of my 5-day bowel detox book, which contains a lot of great stories. In fact, most of what I've told you in this video, along with a lot of things that I haven't. And it tells you in detail what the anatomy and physiology of your bowel is like, how it should work, what's going to happen when you take these formulas, what's in these formulas. A lot of information for those of you that want to dig deeper in knowing about your bowel and how to get it clean and how to get healthy doing a bowel detox. So that's it, my 5-day bowel detox program. Now I'd like to introduce the next in my series of herbal shots, the new bowel flush shot. The reason I created the bowel flush shot is simple, to do exactly what it says on the label, to flush out the entire contents of your bowel. I used to use this in the clinic for my patients who had literally OD'd on eating. What does this mean? Well, we can look at it in a number of ways. Some of you just might say the old classic, I can't believe I ate the whole thing. Some of you may have gone to a party and went outside your food program. Some of my patients used to say I fell off the program. To me, it was more like they leaped off the program when I heard what they consumed. Some of you might be just going out on the weekend and eating, but the next thing you know is you're eating all sorts of food and snack food for lunch that you don't usually consume, and then nighttime rolls around and you ate entrees that you don't usually eat. Maybe it was animal food, grease, garbage, 2 orders of French fries, lots of sugar. Maybe it was dessert where you went nuts. And probably, if you were like most of my patients, you went nuts from the time you woke up to the time you went to bed. You ate the big old-fashioned breakfast. You ate lunch, and lunch didn't end. It turned into lunch, then it went to brunch, then it went to dinner, and then the next thing you know, you ate pounds and pounds and pounds of flesh and dairy products and eggs and sugar sugar and grease and all sorts of foods that you know that if they stay in your body, they're going to make you sick. You're going to feel awful. It's going to take days for them to get out of you, and they're going to poison you. They're toxic. They're going to poison the cells, poison you, poison your body. And really what you want to do is repent your sins. This is where I become Father Schultz. But really, breakfast, lunch, dinner, maybe the whole weekend, you were out of control. And now it's midnight, and you know if you would do anything just to get all this food out of your body in the morning, get rid of it. Okay, you screwed up. You made a mistake. You ate it. But do you really have to live with it? And the answer is no. I mean, you could think of this almost as an herbal shot enema, but you don't have to use it up your rear end. It's something that you can drink, and by the next morning, it's all gone. That's really the bottom line of what the herbal shot does. I'd love to say that we lived in a perfect world or that we were perfect, but the bottom line is the only one that's perfect is me. All of my patients were imperfect. They all messed up. They all fell off the program, more like jumped off, leapt off the program. They all ate tons of garbage every once in a while. And it doesn't make any sense that once you eat it, to live with it. And that's what the herbal bowel flush is all about. Another reason to use the bowel flush shot might be that you're on vacation and you've eaten food that you're not used to, or you're traveling and your bowel hasn't caught up to the new time zone you're in. Or you've eaten a meal and afterwards you have a little bit of that uh-oh feeling. You don't feel sick to your stomach, but you feel like it's caught somewhere in the middle, and you just really want to move the entire contents of your bowel on through. That's where the bowel shot really comes in handy, especially traveling or when you're eating strange food. Again, it's going to get the entire contents of your bowel emptied out sometime the next morning, usually before noon. This formula also contains some powerful carminative herbs. Now remember, carminative means herbs that release gas and relieve gas and spasm, because really we're using a very strong formula to increase the peristalsis, your natural muscular action of the bowel, to empty your bowel out. But we want to make sure that you don't have any extreme gas or cramping that when you're doing this. So this formula is loaded with the Hawaiian yellow ginger rhizome, which is a very powerful herb. Again, the Chinese say it's the downward energy herb, and I really like that because it drives everything in the direction of out from your mouth to your anus. Now, the formula also has my peppermint spirits in it, and peppermint is our great bowel antispasmodic. We want lots of muscular contractions to empty all the fecal material in your bowel. In fact, empty everything in your digestive tract, but we don't want spasms. And peppermint is a beautiful antispasmodic for the entire digestive tract. And additionally, there's aniseed. Aniseed is a great carminative to help relax the bowel and expel gas. Now, on top of the cathartic herbs and the herbs that cause the peristalsis, and on top of the carminative herbs, there's a few other groups of herbs. Also in this formula is my herbal anti-parasite complex. Now, parasites can be anything from roundworms and tapeworms to flukes to microscopic protozoa and their larvae. And you might say, well, how would I get this in my body? Well, it's simple. Did you know that 1 cubic inch of USDA grade A beef has over 1,000 parasite larvae in it? Now add fish to that that's loaded with worms and parasite. And so if you eat any type of animal food or animal product, it's easy to get a parasitical infection. But you can get parasites just from water. So these herbs are famous for destroying the larvae, destroying the eggs, killing the adult parasites, and getting all of this out of your body. Now, the herbs that do that I put in this formula are agrimony, black walnut, cinchona, or Peruvian bark, the famous herb from South America that contains quinine that kills even the malaria parasite, clove, golden seal, and thyme. And these herbs working together are a powerful herbal anti-parasitical formula for your body. Now, in addition to those powerful herbs, it's all in a base of prune concentrate and fig concentrate. And I really don't have to tell you what your mom probably did about prunes and figs and how they flush out your bowel. Okay, so what's the dosage? Well, that's simple. It's a shot. And all my herbal shots, you do one thing. You shake them up, you open them up, and you drink the entire shot down. Now, what can you expect from using my bowel flush shot? Well, you can expect that you'll sleep well, and then the next morning, sometime between you wake up and noon, you will have to evacuate your bowels. And pretty much everything that was in you will come out. Now, I want you to relax a little bit on the toilet. So many people are in such a quick hurry to get off the toilet once they have a bowel movement. I want you to have your bowel movement and sit there for just a few minutes, because what you will often get with a bowel flush shot is what colon hydrotherapists refer to as a cecal flush, meaning that everything in your entire colon will eventually empty out. But sometimes you have to relax a little bit to let that happen, to allow that to happen. So when you feel the urge to go to the bathroom, you'll sit on the toilet, and the next thing you know is your bowel will start working. But give it another minute and make sure it's done, because you'll usually have a cecal flush, which means the entire contents all the way up your descending colon, across your transverse colon, down your ascending colon, into your cecum. That's where the name cecal flush comes from. All the way to your appendix will all be flushed out of your bowel. And now you know that everything you consumed that horrible day and night before, well, it's gone. It's now out of your body. So finally, hey, we all make mistakes. We all leap off the food program. But don't beat yourself up emotionally, and don't let what you consumed beat you up physically in your digestive tract. You can get it all out and start over again with my bowel flush shot. Now let's talk about my intestinal formula number 3. Intestinal formula number 3 is a mild, liquid cathartic formula for the bowel. It contains our 2 great cathartic herbs, senna leaf and pods, and cascara sagrada, but in a much milder dose than would be in either my intestinal formula number 1 or my intestinal formula number 1 maximum strength or the bowel flush shot. This is a much milder formula. In fact, in the clinic, I use this formula almost exclusively for children. It also has the great carminative herbs of anise and clove, and I flavored it with tangerine oil, so this one tastes really nice. Again, I had kids in mind when I made this formula, and it's in a base of California fig concentrate, so really it tastes kind of like an orange fig with a little bit of anise, a wonderful flavor for kids. The dosage is about a teaspoon. Now, that can be more or less depending on the person. With children, always remember that most dosages are based on the old Clark's rule, which is weight. So the average adult dose is based on a 150-pound individual. If your child weighs 15 pounds, well, we're looking at 1/10 of the adult dose. And if you're using it on a horse that weighs 1,500 pounds, you're looking at 10 times the adult dosage. So basically remember that the average dosage is on 150 pounds, so you would make a fraction by putting a child's weight or anybody's weight over 150 pounds, and that will tell you what portion of the dosage on the side that you should use. But generally, with this formula, you would start with a teaspoon and then work your way up if necessary. But with small children, you can start with less. Remember, friends, constipation often starts in childhood. Children are afraid to leave their parents. They don't want to go in strange bathrooms. Often these bathrooms are filthy. Heck, they even scare me as an adult. So often the habits of constipation and the food that constipate you starts in childhood. So you can stop a lifetime of suffering with your children by getting them to know and understand what good bowel health is and to feel what a good bowel movement is. So anytime you suspect that your child is backed up or a little constipated, do not hesitate to use the intestinal formula number 3. It's mild in action, it's safe, and your child, well, it'll put a smile on their face. The next formula I want to talk about is my digestive tonic. Now, this tonic is for your upper gastrointestinal tract, for your stomach and duodenum. This formula is to help you to digest the food that you ate. Now, indigestion can come in many forms. It can be what we call indigestion, where you feel like your food is stuck almost in your esophagus, to heartburn, that burning sensation and acid. It can be digestive cramps or colic or a stomach ache, and this formula works for that. It can be nausea, and this formula is great for nausea. Or it can be the new disease on the block, acid reflux, which really was what in the old days we called indigestion or heartburn, but nowadays it's called acid reflux, where the acid is splashing back up into your esophagus because you just can't possibly digest the food that you have eaten. Now, this can be for a number of reasons. It can be because you have weak digestive ability, where you're not producing enough bile, or you're not producing enough hydrochloric acid or digestive enzymes from your pancreas. But it's usually because you ate a lot of garbage. Okay, all those commercials we see on TV where a person says, I went to mom's house and I ate her spaghetti and meatballs, but I feel so bad I can't digest it. Well, no problem, just take these pills. I got a great idea. Tell mom you don't want to eat her spaghetti and meatballs anymore. The real cure for indigestion is stop eating food that you can't digest or that no one could digest, like a ham sandwich. That's totally indigestible. Anyway, this formula is to aid and increase your digestion. It stops indigestion, heartburn, gas, cramps, colic, stomach ache, and nausea. It is a digestive aid, an herbal digestive aid. Okay, what's in it? 3 of the most powerful and classic digestive herbs. First, we'll start with ginger. Here we go again. Ginger rhizome, Hawaiian yellow ginger rhizome, one of the most powerful herbs to move everything down. Remember, ginger aids the peristalsis from your mouth to your anus and keeps everything moving downward. One of the greatest herbs for nausea. Secondly is peppermint. Hey, did you ever wonder why they have after-dinner mints in every restaurant? Well, the reason is mint is a great digestive herb and a great antispasmodic for indigestion. But nowadays we've degenerated that idea to some horrible sugary fake mint candy at the end of a restaurant when you pay the cashier. But really what we're talking about in this formula is organic peppermint leaf and botanical menthol, one of the ingredients in organic peppermint leaf. And the peppermint leaf and the menthol are very strong digestive aids, carminatives, which relieve gas, antispasmodics that stop spasms. Extracts of peppermint oil are even used around the world by medical doctors to put in your bowel before a colonoscopy. Ouch! Before a colonoscopy to stop your colon from spasming. They are powerful antispasmodic herbs. And the last of this dynamic trio is fennel seed. And fennel seed, just like ginger and peppermint, is a powerful carminative and antispasmodic, relieving gas, cramps, colic, indigestion, heartburn, and the new disease on the block, acid reflux. But these 3 herbs together, ginger, peppermint, and fennel, are powerful, powerful herbs to assist you with any problem you have with your digestion and stop it from happening. One additional thing is this formula is the absolute cure for motion sickness. I don't care if it's planes, trains, automobiles, cars, or some ride at Disneyland. These herbs are fabulous for motion sickness. In fact, in double-blind, placebo-controlled studies, ginger rhizome has always proven more effective towards motion sickness and nausea than all of the motion sickness drugs available over the counter and even under and behind the counter in drugstores. So remember, the digestive tonic is fabulous, especially if you take it before you go on any of these trips for any type of motion sickness. Now, how much do you want to take? Well, I always count herbal tonics in dropperfuls, not drops. So remember, with every herbal tonic, shake it first. Then you open it up and take out what comes up in the dropper naturally. Now, that's not a full dropper full, but you can't make a full one. This is what I call a dropper full. And if you were to count it out, you would find that it's about on average 35 drops. But life is way too short, and that would be way too boring to count out 35 drops. So when I talk about taking herbs, I talk about droppers full, which is really whatever comes up in the dropper every time you give it a good squeeze. Now, the dosage for the digestive tonic is anywhere from 1 to 4 droppers full on average. How do you take it? Well, you can take a little ounce of water, add about 1 to 4 droppers full in that water, stir it up, swirl it around, knock it back, and that's it. Now, you can take this straight into your mouth, but it's a little intense. But often, my customers used to just tip back, put 2 droppers full in their mouth, and then take a swig out of their water bottle. Now, you can also take a small water bottle that you might be traveling with and put about 10 droppers full of this tonic into your water bottle, shake it up, and then sip that all day long. There's a lot of ways you can use it, but remember, think about it anytime you're thinking about indigestion, heartburn, nausea, gas cramps, colic, and acid reflux. Another great time to use it is at night. A lot of my customers kept it on their nightstand, would wake up at night with acid reflux. When you wake up with acid reflux, I would suggest to go to between 4 and 8 dropperfuls right away, either in a little water or straight in your mouth. Knock it back with water, lie right back down. You'll be able to go back to sleep. This is going to fix your digestive problems. And now I'd like to introduce my new digestive shot. It's a powerful dosage of my digestive tonic formula, along with additional herbs to aid your digestion. The whole idea of my herbal shot line is really my herbal shots are industrial strength clinical dosages for particular herbal formulas that I used in my clinic. Because often I find that Americans in general, but my patients specifically, did a lot of pussyfooting around when it came to taking their herbs. So I decided to put my kind of dosage, a super Dr. Schultz dosage, inside a bottle, along with additional herbs and additional bases, and put that in a shot for you to drink down and knock back. And now I know you're getting what I would have given you in the clinic when you were sick, not what you might kind of half-heartedly take if you're left on your own. What's in each one of my digestive shots is 10 dropperfuls of my digestive tonic. Now that's the dosage I would have given you if you came to my clinic with acid reflux, heartburn, indigestion, nausea, cramps, colic, or any of those. Because I don't pussyfoot around. When you need herbs, I give you a full industrial strength dose. Now 10 dropperfuls of my digestive tonic formula is a very powerful dose. But on top of that, I've added extra yellow Hawaiian ginger extract, and I've added extra peppermint spirits. Now you'll notice it when you knock this shot back. It's a wow. Now along with that is my enhanced papain papaya puree. And remember, papain is a powerful digestive enzyme. And my enhanced bromelain pineapple puree. And remember, bromelain is a powerful digestive enzyme too. Together, they help break down food while your body's trying to also break down the food in your digestive tract. They almost pre-digest the food for you. Because of that, they've been ingredients in meat tenderizers and other pre-digestive food aids for years. So what's the dosage of the digestive shot? The same as all my shots. I want you to shake it up, open it up, and drink the entire contents of the shot bottle. This is a good tonic to have on your nightstand because, again, you may have gone out and had a lunch or a dinner that didn't agree with you, and on top of that you had dessert and coffee and sugar and animal fat and God knows what else you consumed. And you've come home and you know you're in trouble. It would be a great idea to take the entire shot before you go to bed. If you didn't, and you wake up in the middle of the night with acid reflux and you have that horrible burning in your throat, well, take the shot now, either before bed or if you wake up in trouble. Shake it up and take the entire shot. And what you're going to notice is you're going to be able to go right back to sleep because the acid reflux, the heartburn, the indigestion, the gas, the cramps, the colic, the nausea, gone. So friends, that's it. Those are my 8 digestive and elimination clinical herbal formula. Now, I just want to say one last thing. In my clinic, I saw many people that I didn't get to in time, that's lives were ruined by doctors, drugs, and hospitals, where they were mutilated and had their bowels cut out and resectioned and had to have colostomy bags glued to their side or had ulcer surgeries or cauterizing surgeries on their bowel and their rectum and their anus. Don't let this happen to you and your loved ones. It's unnecessary pain, unnecessary torture, and certainly an unnecessary hospital bill. So don't let it happen. All you have to do is eat right, change your food program, and stop eating the things that are making you sick and that your family has eaten maybe for generations, that has made them all sick. You didn't inherit this disease. You probably inherited the tendency to eat this way to cause the disease. And on top of it, for any of the disturbances or imbalances or even simple constipation, use my herbal formula. They will be an absolute blessing in your lives.
Knjige doktora Richarda Schulza, Lečenje neizlečivih bolesti, 30-dnevni program čišćenja organizma i druga izdanja, kao i biljne preparate i tinkture prema originalnim receptima doktora Schulza možete nabaviti putem telefona 063 732 7738 ili preko web sajta drschulz.com. Ukoliko želite da studirate prirodnu medicinu iz svog stana putem interneta, posetite sajt institutpm.com ili zakonizdravlja.com. Upis je otvoren tokom cele godine.